Right. So the first question we have is obviously like a lot of people don't know what endometriosis is. So how would you explain endometriosis to someone who's hearing it for the first time?
Hmm, I've never been asked that question before. Okay, I'll think about it. Uh, I guess the best way to explain it is one, of course, is that it's highly um, misdiagnosed for the most part, um, that it affects young women when they start having their periods, and most physicians, particularly pediatricians,
Mhm.
are not trained to recognize that.
Yeah.
So to them, a lot of times the misconception is, oh, that's part of growing up, just put up with it and it'll go away. Some physicians that might have a little bit of an inkling about the disease might realize that there might be, and they put you on birth control pills and hope that the pain will subside. So, and there's a lot of misconceptions in terms of that aspect of it. Is it really endometriosis? Obviously, if it prolongs for a long time during your periods, you're completely incapacitated, really bad menstrual cramps, and all of the other symptoms that I'm sure you guys have read about.
Yeah.
And that should give a physician a clue, or at least have uh, the patient sent to somebody, maybe an adolescent gynecologist who might have a better understanding of the disease, uh, and try to catch it as early as possible and not uh, sort of poo-poo it and say, well, that's part of growing up.
Yeah.
I think that's probably in my mind the biggest misconception
Hmm.
is there isn't enough medical knowledge uh, that recognizes this as something that's very painful and a disease that'll go on for the rest of her reproductive life if it is not treated.
Yeah. And like I think while we were doing like some research, like I was so surprised to find out how commonly this is misdiagnosed and
Oh
like
yeah.
how common this occurs in women. Like
Yeah.
so like that kind of like leads me to like my next
Uh,
question. Like even though this is so like common in women, why do you think like so many people aren't educated about it? Like what are
Well,
some reasons?
several things. Okay. But before I get to your other one, that's why it takes 7 to 10 years to diagnose. Uh, Most girls don't want to talk about menstrual pain. So I think it's kind of a taboo subject and it's not discussed much. Uh, mothers who have not, Mothers who are aware of it or who have suffered from endometriosis themselves will start to recognize it, but that's few and far between. For the most part, I think it's in school, oh, I've got menstrual cramps. Oh, well, I get menstrual cramps too. So it's okay. And I think that's part of the reason for being misdiagnosed to a large extent. And then you sort of accept it as part of your life and go on. And when it comes to a point where it's either totally unbearable and you realize that this pain is not normal, and there's a lot of uh, campaigns out there right now uh, in certain states and certain countries to indicate that menstrual pain is not normal. All right. Uh, but so recognizing the fact that this is not normal and this needs to be looked at, and convincing parents to make sure that the girls are seen by somebody more than an average pediatrician. And so I think
Yeah.
the stigma, uh, unawareness, just talking to friends in school where they say, oh, yeah, yeah, I get pains. And, but, do your pains go for 3 days? You have to put a hot water bottle on your stomach and lay in a fetal position just to get the pain to go away. And those are not normal symptoms.
So other than like really painful like period cramps, are there any other like symptoms that should alert someone to go get a diagnosis?
Well, that's also one of the problems, right? Because the amount of endometriosis doesn't correlate with the pain. So a girl or a woman could have basically a small lesion and be in the most excruciating pain, or you'd have tons and tons of lesions with no pain. But anytime there is painful menstruation, I think that's your first indication that you need to be seen by somebody who understands the disease.
So even with like modern like medical technology, why is it still difficult to diagnose endometriosis for a lot of women?
Oh, because one, like I said, not every woman has the same amount of pain, but also uh, there's no diagnostic, right?
Yeah.
This is what we've been stuck with for years, well, for over 100 years. And trying to find a diagnostic has been one of the most challenging things about this disease. Where do we look? Do we look in the blood? There are no markers. Do we look in urine? Do we look in menstrual tissue? And, there's more and more research happening. But because the disease is so heterogeneous, it could be an ovarian disease, it could be a superficial disease, it could be a deep infiltrating disease, it could be nothing at all other than maybe inflammatory bowel syndrome or something that's sort of related, but not endometriosis. So until you can visually actually diagnose the presence of the lesions, there's no way to tell for sure that there is endometriosis. And that's part of the reason I think there's funding becoming available, and particularly, trying to see whether there are markers in menstrual tissue. And it's very variable. That's the other problem, is that because of its heterogeneity, there's no one marker or two markers. Just take an example of breast cancer, right? You have BRCA1, BRCA2, you can identify it, you can diagnose it, and be certain that you're carrying a marker for breast cancer. And we don't have any genetic markers. All of the analyses have not come up with that one magic bullet, or at least a group of molecules to be able to tell, yeah, this is a good indication.